All right, welcome to the Student Athlete Performance Podcast. I'm your host, Nick Lemke. Today we have Dr. Tiffani Michel, a performance physical therapist who specializes in injury recovery for basketball players. I'm excited for this episode in particular because we're going to do things a little bit different. We really wanted to give you guys good value and kind of a full experience. And so when we talk about injury recovery, we're going to tackle it from a physical therapist and a dietitian perspective. So we're going to talk about a few things beyond just the PT or beyond just the nutrition piece. Plus, we're going to get into some injury prevention and how to minimize your risk for injuries. So, Dr. Tiffani, thank you for joining us today.
Of course, thank you for having me.
Of course. So let's start off with just your journey as an athlete. You were a college athlete. If we can kind of walk through how you became an athlete and how's that shaped, you choosing to work with athletes.
Sure. So I've been an athlete since before I can remember, 5 years old, playing soccer, basketball, run track, played softball, and it's just kind of been a part of my life for as long as I can remember. And so I ended up going and playing high school. I got injured, pretty significant shoulder injury that I kind of pushed through a little bit. And then when I went to college, got injured again. That time I decided to, end my college career and just become that person that athletes can go to kind of get back and just be that person that I've gone through what they're trying to do. So I feel like I can relate and help them get back to sport.
Okay. So you talked about injury in high school and in college. Was that the same, similar type injuries?
So both were to my shoulder, same shoulder. First one was I was diving on the floor for a ball, ended up dislocating my shoulder. That was my second game of my senior season in high school. And so I was trying to go after a college scholarship there. So I ended up hiding the injury and continuing to play. I would dislocate my shoulder, go back in the game. Next day, couldn't lift my arm. I ended up waiting to the end of the season to have surgery once I had secured college scholarship. By that time, my coaches knew about it because it became pretty clear. But had surgery right before I went to college, and then I played my freshman year. That was pretty successful, and ended up transferring schools. And I would say by the time I hit my junior year, I was going up for a layup in practice, and one of my teammates tripped me while going up for a layup, and I fell on my back, injured that same shoulder again. So first time I had a labor repair, second time it was what's called a Hill-Sachs lesion. So I ended up having surgery again. And at that time is when I decided to cut my basketball career short and get into helping athletes return to sport.
Wow. Okay. So yeah, that's hard when you're injuring the same shoulder. And this is something I've heard other athletes talk about. They injured the same hand or wrist or knee. And so like what did you learn from that experience of that repetitive injury?
That for one, it's something that's typically going to be something that you're going to continue to have to manage. I think people think about, I have an injury, I'm going to potentially have surgery or do physical therapy, and that's the end of it. But it's actually like a maintenance process that needs to happen. And so I always tell people all the time, it's my favorite thing. You brush your teeth every day. We have to continue with some of the maintenance work for our bodies as well. And so that's the one thing I didn't realize going into it. And now my approach has changed as far as approaching my own health in that way.
Yeah, I like that. This is something where I've kind of learned that myself. So I've had tendonitis in both shoulders, and it's one of those things where if I don't keep up working on strengthening the back and trying to like offset those imbalances, it starts creeping up again. So if I don't do those exercises, I start getting more of that twinge, more of that discomfort in the front there. So yeah.
Absolutely.
What about, so you've had the shoulder injuries, but you've also had one post athlete, post college, and it was one of those that I feel like really impacted how you approach things. But I think it's something that the athletes really need to hear on this. And so, like, can we talk about that more significant injury you've had?
Yeah, every time you say it just gives me chills about like how it's changed my life. But um a couple years ago now, I had a injury where I was going to hot yoga, not feeling so well, and I continued to push through. Just like any athlete would, continue, kept going, and I ended up getting into a space where I didn't feel so well. And I knew something was about to happen. I just needed to get out of the room. Because if you haven't taken a hot yoga class before, those classes can be anywhere from 80 to 100 degrees. And so I stepped out into the lobby, tried to sit on one of the benches that were near, and I ended up fainting. Fell on my head and face first and had a brain injury. And it's been something where it took a couple years to come back. And one of those things that when I was approaching recovery for this is that I kept going. I kept pushing through. I was back at work on Monday. That happened on Saturday.
Wow.
And so yes, I had difficulty. I had some dizziness, some fatigue, headaches and brain fog. But I kept going. I was like, I'm gonna get through this, however that looks. I'll do what I need to do after work, and that didn't serve me well. And so that's kind of how I got into the space of I need to take care of my body better. And it mostly came from the lens of I didn't have a choice anymore.
Mm. Wow. Huh. Um, so there's a lot that we can address on this. What would you, so you talked about the pushing through it, and this was kind of a common theme you mentioned with the shoulder, and now even with that injury. What's your advice, because in athletics, we're naturally, we want to push through it. We just keep grinding, we keep going. How do we balance that? Like, when we want to be successful, but then also recognize where to draw the line.
Absolutely. So for me, um, in each of those moments, I heard myself like having conversations in the back of my mind, like I probably should stop. Um, and because our, natural culture is to keep going, I just decided I'm not stopping. I'm gonna keep going. But knowing what I know now is that we actually end up being more productive when we stop and take a look at all the factors and just kind of make changes to some of the daily things that we may do, whether that's I'm not getting enough sleep. Prior to my injury, I was looking back at some of my metrics, and I was getting 6 hours of sleep. My body does not operate well, or most people's don't, on that amount of sleep. And so once I started recovering from my brain injury, I found that my body actually needs more so 8 to 9 hours of sleep. And that's when I started to feel my best. So making sure we take a look at all the variables. I know it's important to, push through and meet that next goal on whatever that looks like, because it's not just sports, it's work included in that as well. And so if we can kind of reframe the way that we think about being productive in a sport or a job, it makes a world of difference.
Yeah. I do like that you're emphasizing that sleep piece too, because that is one thing that, even as dietitians, even though that's not our like specialty, we know how much it impacts that recovery. And it's like, I always reference there's this study, I think it was done on Marines, but they found that, those who are getting like 6 hours of sleep a night were like 50% higher risk for significant injury. And so, I mean, more likely to make those mistakes because we're tired, but then also, our body's not recovering from that exercise. And so it's really difficult. That's part of our key area of recovery for sure.
Absolutely.
What about, so as a physical therapist, there's definitely some injuries you see come up often with your athletes. What are some of those injuries, and how do you approach the recovery of that?
So a lot of the injuries I see are mostly going to be extremity based. So your knees, ankles, shoulders, especially in like I treat a lot of basketball, baseball players. So those are typically the things that we're going to see. As far as approaching that recovery, and you just have to look at it holistically. What's that athlete eating? What's that? How much sleep are they getting? What's their training program look like? I find a lot of times that a lot of athletes are training 7 days a week without any breaks because, again, that hustle culture and push through. So just approaching those injuries holistically and figuring out what are all of our factors? What can we address? Try not to change too many things at once and burden the athlete in that way. Um, but also making sure that we're taking into account all of the most important factors which can lead to an injury or minimize your recovery process.
I like that. So I know that your background, particularly your more recent injury, impacted kind of that more holistic approach, that more like taking multiple approaches or multiple sides of that approach. So you mentioned sleep, mentioned nutrition, like what are kind of those key things that you started to do to help improve your recovery process?
I would say one of those is actually hiring a dietitian. Um, Food has been something that I struggled with my entire life. I was that kid that would eat chicken fingers and rice, and that was it. And then wonder why I'm always tired or not have enough energy, whatever that looks like. And so I would say when I got to the towards the end of my recovery, I was doing a lot better. But there was still something that I felt just wasn't quite right. I still was having some fatigue. So I ended up hiring a dietitian, Emily Barnhart. She's Injury RD on Instagram. And she took a look at my food log for about 3 days and she said, "You're absolutely not eating enough." And so once I began to um, start just going off of her advice and eating every 3 hours, making sure I was sustaining a like healthy meal at breakfast, at lunch, dinner, and throughout all of my snacks. Um, I really started to feel much better than I ever had in life at that point.
Mm. Yeah, this is something we see consistently, whether you're injured or not, is that not eating enough. Like I even hear, like you mentioned, you work with baseball players, but again, the basketball players especially is they're like, yeah, we just have a really fast metabolism. We just can't, gain any weight because they just have such a fast metabolism. And I'm like, no, you're just so freaking active and you're not eating enough to catch up with that.
That sounds exactly like her. I remember having a conversation with her one day, and she's like, I was like, I don't know why I'm getting so tired. I feel like I'm eating a lot and not doing that much. And she was like, how many hours a day are you on your feet? I'm like, 12, 11. She's like, most people aren't doing that. You're definitely not getting enough food.
Yes, yes. So you mentioned a little bit that that was in a way like a setback for you in terms of, you're still feeling like you weren't energized, but also like I know just in general with some of these injuries, there's those like setbacks during that recovery. And this can be really frustrating as an athlete because you're like, I want to get better. I just want to get back on the field or on the court. What's your advice to athletes to keep them motivated to keep going through that recovery process and be patient with it?
Absolutely. I think for one is staying positive. Know that things always get better. There's truthfully not one person who's gone through something and where it doesn't improve in some capacity. So that and then seeking the support of the people around you. There are so many people who want to see you win and do better. And if you can reach out for help, that's huge. I think a lot of us are when we get injured or we have a setback, we want to kind of close off everyone else and try to deal with it on our own. But knowing that we don't have to is super important. And then for me, it was set realistic goals and revisit what those goals look like. Because if you can celebrate your small wins along the way by just, taking videos and pictures when you first have your surgery, for example, and watch as your body progresses and so that you can remember how far you've come. That's huge in staying motivated because I remember there are a lot of times where I did not remember how bad I was doing. There were days where I couldn't get out of bed. Now I'm like back playing basketball, running around doing everything. And I think if I didn't have, you know, those memories from the picture and the video and that kind of thing, then it would have probably been tough for me to realize how far I'd come.
Yeah, I love that. Like you mentioned the community piece and then the progress piece, like community, whether that be like other athletes or other people in that recovery, but then also, like you said, like finding those people who can actually help you through that process. Investing in some of that, because it otherwise, if you don't invest in it now, you're gonna suffer later.
Right.
Um, and on the progress piece, like y'all probably should go back and listen to that, but also take it in the frame of mind that you, not just as an injury, but as just as an athlete or as a person in general. So we so often focus on, we're this far away from our goal, or we didn't reach this milestone. We set a goal for 3 months and we didn't make it in 3 months, but then we forget about all the progress we made. So really lean into that progress piece, really lean into how much you've grown, and just find ways that you can keep improving. Just like, Dr. Tiffani did, she found those things that she needed to improve on, the nutrition piece, to keep improving. And so keep finding ways to improve and focus on that progress piece of that.
Yeah, I love that. And then to add on to that, I would just say focus on the things that you can do. Oftentimes we'll look at, oh, I injured my knee, so I can't go running, but can I go to the gym and lift upper body, or could I, whatever that looks like for you. Just making sure you include the things that you can do. And I think that can even include things that aren't physical. I would say a part of my journey in going to the Shepherd Center for my concussion rehab is that they introduced me to a psychiatrist, psychologist, so that I could help with my mindset. Because me going back into sport was it's a very hard thing to do with all of the injuries that I've had, and I hadn't processed those. And so, from a mental standpoint, we don't understand if there's other things on our mind that are clouding some of our judgment and decision making, that can affect how we perform on the court as well. So, even if you can't take the time because of an injury to do something physical, um, our mental is a huge part of that as well.
Yes. This is what we're talking about. Like the physical, the nutrition, the mind. Like if you really want to be a successful athlete, if you really want to overcome injury, yeah, take that whole approach to it. Like, there's different aspects. And you talk about that grind culture, that desire to just keep working 7 days a week. Maybe work 7 days a week, but one of those days is more focused on some of those mindset things, or more of that like other growth, the recovery aspect. But doesn't mean you have to go hard in the gym every single day type of thing. So I know you had, because again, like it's clear that nutrition was a big part of your journey. But I know you had some questions for me around that nutrition and recovery piece that you wanted us to dig into.
Absolutely. All of my athletes are coming to me after surgery, sitting on the table, first day post-op, and it's like, so I'm not going to eat that much because I'm not moving. I'm not as active as I once was. What recommendations do you have for them as they try to come back from those injuries?
Hmm. There, there's a lot to that. So it is an understandable fear. You don't want to gain weight. Okay, you're less active, and so in a way, your eating does need to be adjusted. However, this isn't always the case. So when you talk about that surgery process alone, surgery actually burns a lot of calories. That process to surgery and that process post surgery, actually you're burning a lot of energy and you're burning a lot of nutrients in your body. And so these are actually those times where you do need to keep up on that nutrition, especially post op, because there's just so much going on there. Many athletes are getting injured though because they're not eating enough, or because they're not eating enough of the right foods. So that would be like definitely a key piece, is like a lot of you guys might even be getting injured because you're not eating enough, like we even talked about. And so that's the first thing. But there's really two big pieces of this, and it's again why I really emphasize working with a dietitian. Is number one is the risks of not eating enough outweigh the risks of eating too much. So in terms of like the weight, maybe you gain a little bit of weight, that the risk of that or the things that can happen with that are far smaller than the risks of not eating enough. Because the risks of not eating enough, as you shared, it's much more common for an athlete to not eat enough, and that can lead to loss of muscle mass. So if you're not eating enough, you're not eating enough protein, but enough just food in general and good quality food, you're going to lose muscle mass. Your recovery process is going to take a lot longer. So, again, with some of these injuries, if you're not addressing the nutrition, your mental game, your mental focus, your energy, all those things are not going to get better if you're not actually eating for that. But then if we think about like, okay, so if we have wounds, we have tendon, ligament injuries, whatever it might be, those take time to heal. Those take certain nutrients to heal. So if you're not eating enough, your body's not going to recover well from that. And this is something we see in the hospital setting too, where the hospital food sucks, and so people don't eat after surgery, and they end up getting stuck in the hospital a lot longer because they're not eating, they're not actually recovering. So that is part of that. And then the last piece on the risks of not eating enough is also infections. So when we think of like bacteria and all these different problems that can happen with like say we have an open wound from an open fracture, like we're not going to be able to really recover, and that's going to potentially put us at higher risk for infections, which again is going to slow down that recovery process. So, again, the risks of not eating enough outweigh the risks of eating too much. The other piece of it is the quality versus quantity. So right now, most of you athletes out there, from basketball, football, baseball, soccer, and all the other sports, you're eating like every other American. You want to be a part of the 1% of athletes that make it, that go D1 or make it big, but you're doing the things that the other 99% are doing, which is eating fast food all the time, eating chips all the time, not really being intentional with how you eat. So if you live off of fast food and chips more than actual meals, then yes, you probably will not recover as well, and you're probably going to not feel as well post-op as well. And it doesn't mean you have to hate the food you eat. You can still enjoy food without living off of fast food and chips and candy and whatnot. It just has to be better than what you're doing right now. And so, and this is a part that I really want to highlight is, especially because we're talking to student athletes, especially parents are listening to this, is it has to be done on a family level. I talked to an athlete that I know, and he was recovering from a shoulder injury, and he was like, felt really bad because he gained weight. But then if we look at it, like him and his family, they tend to eat a lot more, and they tend to eat a lot more like fast food and really like big calorie dense meals without really addressing the quality aspect. But then once his family started making changes to what they were eating, improving the quality of it, he started feeling better, he started recovering faster, and he got to where he wanted to be. So, there's a lot to that quality piece. And so with that, like you need a plan that serves you. So like as you talked about, eating every three hours, that's an easy way to like mentally think about it. So starting with that every 3 hours, adding in protein at each of those meals. Yes, everybody talks about protein, and that's all I'm going to really leave it at is just protein at every meal. Yes, we want more better quality sources, whatever, but there's so much more than just protein. Again, we're burning a lot of energy through that surgery. So carbs pre and post surgery, but then carbs just in general through that recovery process. Again, not the chips, not the candy all the time, focusing more on, whole grains like whole wheat bread or rices or quinoas or things like that. But then the beans, the fruits, the things like that. And then also on the fats piece, going more for the grilled salmon or the sardines or some of those things over the fish and chips. Because there's a lot of little nutrients. It's not just about macros. It's about those little micronutrients, the little pieces that can really help us speed up that recovery process. I know that you reference like LeBron, for example, and like his diet is not like the average American. He emphasizes the fish, he emphasizes more of the fruits, the vegetables, things like that, because he wants to be able to recover well, he wants to be able to perform at his best. So though that piece, there's a Greek yogurt and fruit versus ice cream, there's smoothies with the greens and the berries over a McDonald's milkshake. Like it's again just simple things you can do that can still taste good, um, but also help you speed up that recovery process and help you maintain versus gaining a lot or losing, because again that losing is going to be a lot worse for you than gaining a little bit, because you can recover from a little bit of gain. Yeah, sorry, that was a long-winded one.
I love you said so many things that I haven't even thought about that we can definitely chat about later, but I appreciate that perspective. Can you also talk about supplements as well? Because I think um around the time when I was meeting with a nutritionist, I also spoke with a naturopathic doctor as well, and he talked about how creatine and omega-3s, magnesium, all of those were important really as well. And I saw the effects from those, especially with my sleep and the way that I was able to recover from workouts. Can you talk about those a little bit?
Yes, for sure. So like you mentioned magnesium, I will say there's a lot to magnesium. There's tons of different variations of it. Some of them are used to help us poop or not poop. There's other ones that actually help us like get magnesium into the blood and actually kind of working for us. I definitely do try to emphasize food first with that, because there is a lot of food sources we can get, but as an athlete, it can be really difficult to get enough magnesium, because part of magnesium's job, it helps with muscle contractions, it helps with our muscles. And so if we're working really hard, we tend to need a bit more magnesium than the average person. And on the sleep piece though, too, like you said, is there's the tart cherry juice, which isn't necessarily a supplement. In some ways it can be turned into a supplement, but it's also more of a food approach, but that can help with the sleep piece. I think we were talking earlier and you said you've used tart cherry juice as well.
Buy it every single time I go to Trader Joe's. It's helped with my sleep tremendously, and I can vouch for that just because there have been nights where I would not take it. And I tend to use Whoop now since my injury, and that's kind of showed me, how I've been able to progress as far as my recovery each morning. And so there's a difference in when I take those supplements, when I don't. So they definitely have a huge impact on the way that I feel every single day.
Yeah. And I use these even with my youth athletes. Like I've had high schoolers using this and they've said it's worked, and then their parents start using it and they're like, "Wow, my sleep's better." It's like, yeah, like they really do make a difference for sure. Um and then I know we mentioned the creatine piece. So like before I go into creatine, let's like what's your experience with creatine, specifically with your brain injury?
So I'd never taken creatine prior to my injury. I had heard about it, saw the research on it, but I never felt truly comfortable taking any supplements until I got medical advice. So once I did, they had me taking about 5 grams of creatine, and I would say that it's helped in I don't really get sore like that anymore. I sleep really well. I recover from workouts really well, and it's been great for me to start using for sure.
Yeah. Yeah. And with the brain specifically, so creatine often is talked about with the muscles, but we actually have growing research around the brain piece of it too. And so when we talk about concussions, brain injuries, we're actually finding that, creatine actually drops in the brain when we have these types of injuries. And so what they've started to do is they have some research, they've even done some research in youth athletes where they've shown that taking creatine, and it's usually there's some research that's done 5 grams, some that's done 10 grams, where they split it twice a day. There's some arguments for 20 grams a day even, but I don't think we have enough research to really show that. But I know there's some dietitians even at the college level that talk about that type of protocol. But doing that, especially post concussions, in that first week particularly, but then even afterwards, to help increase that creatine in the brain, and it can actually help improve some of those symptoms. You talk about fogginess and confusion and all those difficulty focusing. There's more and more research to show that creatine can actually improve that recovery post concussions even. So
I definitely see that because that was one of my first signs, probably about 6 months after my concussion. And I had what we call post-concussion syndrome, because a concussion is supposed to heal within a couple of weeks. And it's when it persists beyond that you start to develop these symptoms that are now more longer lasting that you have a little bit more difficulty recovering from. Um, where we kind of look at, okay, what changes can we make? And I would say one of the things that I was like, it was like a red flag going off is that I started having trouble finding my words, and a lot of mental fatigue, a lot of brain fog. And once I started taking a lot of brain health supplements and going into our anti-inflammatory foods and our really good brain foods that we know about, is when I started thinking clearer than I had ever had before. And so I think that goes beyond just, day-to-day things, but also athletes.
yeah.
We make several decisions while playing a sport, and very quick ones too. There's a game that's won within point something seconds, and you need to be able to respond very well. So if you are performing well at a high level, if you're thinking clearly, our sports are impacted by that as well.
Yeah, yeah. And my last piece too, I did want to highlight with these vitamins, minerals, all these different supplements, is they definitely can have a place even in just general performance. So it doesn't mean just because you have an injury, take them. Like some of them can be beneficial. I again emphasize the food first piece. And then I also emphasize with supplements is don't OD on them. Don't overdo it, because that's where, if it's certain ones like vitamin D, for example, we can get hospitalized and mess up our kidneys from taking too much vitamin D. Or if we're drinking all these different new drinks nowadays that are like 1,000% of your vitamin B12, it's like you're peeing most of that out. It's going straight out. So certain vitamins, you're just going to pee it out. Other ones could actually like end up hospitalizing you. So it's all about that balance there. And that's why, again, talk to a dietitian, talk to a professional on this type of stuff.
I think the other thing is making sure that those are safe for you to be taking, because a lot of times they're banned substances within some of the supplements or things that just aren't really clean, that can show up in some of the supplements that are out there on the market. And so you just want to be careful about how you choose those as well.
Yeah. And if you have questions on that, definitely like reach out to me. We can talk about like some of those things. I talk about it a little bit in my content, but again, that third-party testing, but not just any third party. It's especially the NSF certified for sport or the informed sport. But again, if you have more questions on whether you should take supplements, how you can do it safely, all those types of things, definitely reach out. As we transition to the preventing injuries piece, because I know this is something where a lot of us, we're so focused on being reactive. We just try to treat injury, but there's a lot of things we can do to prevent injury. So what would you say can be a big thing that can help prevent or reduce risk of injury?
Yeah, I would say one of the things that as physical therapists, we never are able to prevent injuries. Because sport is so chaotic, dynamic, and things that you have to react to, we can't control all of those forces and things that happen. However, we can do a lot of different things to mitigate the risk of injury. So taking a look at what our training looks like. Are we overtraining? Are we undertraining? Because either way, that can have an effect on our performance and whether or not we sustain an injury. So that's a huge piece. And I know, Nick, one of the things that we've talked about was like movement screens. So knowing where your body has deficits so that those can be addressed to allow you to perform a lot better. I would say that they don't necessarily prevent injury, but they allow us a window in to say, okay, maybe an athlete is lacking some ankle dorsiflexion, and what that is when you think about the ankle coming back this way, is that sufficient? Is that sufficient for us walking, for us squatting, and even for us running? And those are things that we can identify in a movement screen to allow you to make better progress when it comes to your performance and preventing injuries.
Yeah. I heard this too when Clay talked about it when he was on the podcast, is the movement screens. What would you say from your experience and the athletes you work with, what are some of those common areas of weakness that you tend to see in athletes?
Usually weakness is going to be core, not knowing how to control that statically and dynamically. A lot of the times we think of our sit-ups, our crunches, our Russian twists, but if we can really control our core engagement and our breathing from a static position, it allows us to then translate that into positions where we're standing, running, sitting. And a lot of athletes I see don't even know that that exists. So that's one area. And then probably our back muscles. That's a lot of times I see we don't know how to recruit there. And it really just depends on the athlete. Some of them have upper extremity things that we can address. Some of them have lower. So I think that's where it's kind of important, where in a lot of our strength and conditioning programs, it's very general, especially on the high school level. And one of the things I've been talking to coaches about is, can we make can we make it so that it's more specific to each athlete? Because if we're giving everybody the same program, it's helpful, but not as helpful as it could be. It's better than doing nothing for sure, but each athlete has different individual needs and we all play different positions. And so I think it's important to kind of take a look at it from a lens of, we don't eat the same things, right? Because we all need different nutrients. Our body is genetically made very differently. If we can approach strength conditioning and our exercise programming in that way, and so it's very individualized to the athlete, you end up being a lot better from it.
Yeah. Definitely the individualization piece. I mean, it's even like some of mine, this goes to the back piece of it is, when I'm messaging athletes, checking in with them and stuff, and some of them like don't have access to a gym. And so their common things are squats and push-ups and then like maybe something else. And then same with gym, it's all about that bench press. And we completely ignore the back. And so then we're doing all this like forward motion and everything. And then even with like running and stuff, a lot of times that quad dominant versus hamstring. But I do like you mentioned the core piece, because you talked about most of our injuries tend to come from the extremities, not from here, because this is often what's causing, some of those issues is the core. So I like again that you notice what tends to be weaker, and then what tends to get injured most often, and they tend to be connected in some way.
Absolutely. I mean, for me, all of my injuries were extremity. And so for me, it's, how can we look at the entire body as a whole? Because you may have this knee injury or ankle and foot injury that could be driven from somewhere else within the body. And so that's why I think our movement screen is also really important, because it just allows us to identify what is this particular athlete's weakness and how can we make that better for them so that they're not experiencing multiple injuries just pop up here and there. And I think a lot of times in our traditional outpatient physical therapy clinic, for example, you get a prescription to go in for this one body part that you're being treated for, but it can absolutely be driven by something on the other side of the body. And so that's where I'm like, I want to take a look at the person as a whole and make sure that they're getting exactly what they need, not just, oh, let me look at your right shoulder because that's what's hurting you.
Yeah, I like that. So then also on the prevention piece of it. So when we talk about trying to be a little bit proactive, trying to get ahead of the game, what are some ways that if you can talk into the importance of like listening to the body better, and even like, if an athlete has like a knee twinge, for example, which I feel like one of the most common things I see or hear athletes say is something around the knees. Like, what would be your advice around that?
Don't let those things linger. A lot of times there are very minor things that can be cleared up within a session or two. And a lot of athletes are like, oh, it'll just go away. Um, and a lot of times that doesn't happen. It ends up turning into something bigger. And I would say not that you need to go into your training room or physical therapy clinic and say your whole body's hurting every time, but like if this injury is persisting beyond 2, 3 days, if it's not just a soreness because I worked a new muscle, then let's try and get it checked out if you have access to it. And I think the time that we live in now, it's a lot easier to do that because it doesn't actually have to be someone who's wherever you live. There's healthcare providers that are doing a lot of virtual and telehealth appointments, and we have the necessary skills to be able to evaluate you online versus having to touch you in person. So even just to give you advice on what this injury could be, how you should move forward, those things are important as well.
Yeah. So even if you live in some tiny town in the middle of nowhere, you can still hop online and reach out to one of these expert physical therapists.
Thank you.
Yeah. Any last words of advice for the student athletes out there?
Yeah. I would say just continue to reach out to your support systems and find ways that if you need help with something, there's somebody who knows somebody that can help. You don't have to go through whatever it is that you're dealing with alone, whether that's from a mental standpoint, a physical standpoint, you need help with your nutrition, doesn't matter. There are so many of us out there who are honestly actually giving out a lot of free advice. And so it's not all the time paid, and you can take advantage of some of those things that a lot of our healthcare professionals are offering.
Yes, that is the power of social media. You know, it can be used for bad, but it can also be used for a lot of good. And this is one of those things where you can really leverage your social media by following following these experts, following people who can help you. So, you know, on that note, how can athletes help? How can athletes follow you as the expert?
Yeah. Usually you can find me Instagram. My handle is at Tiffani Nicole, and Nick will have that down in his comment section, so you can kind of click on that and just send me a DM. I'm always willing and able to respond to you if you have something you want to kind of work through. We can definitely set up a call and try to get things figured out for you. Even if I can't help you, my network is pretty big, and I usually know someone who can help. So continue to reach out.
Yes, yes. And if you need help with, again, finding those experts, finding Dr. Tiffani, you can also reach out to me. Trust me, I will get you that network that you need. So again, Dr. Tiffani, thank you so much for sharing your insights and expertise with us today. I know a lot of our listeners and those who aren't listening yet need to hear this kind of stuff. They need to hear the recovery, they need to hear the injury prevention piece, and they need to learn how to be proactive. So again, listeners, you know, if you want to play your sport as long as possible, be proactive about it, get ahead of the game, take action so that you're not having these career-ending injuries. You know, there is hope, there is possibility to get through those things. So, and again, listeners too, please share this with your teammates, your athletes, your coaches, regardless of where they come from. I know this is going to be really valuable for them. Thank you again, Dr. Tiffani.
Thank you so much for having me.
You're welcome. And until next time, keep striving for greatness.